Welcome to Good Samaritan Spotlight. I'm going to be your host today, Adam Thacker. I'm President and Chief Administrative Officer. Really excited today to welcome Dr. Leo Drozhinin. Goes by Dr. Leo.
That's right.
And Dr. Leo is a new addition to the medical team here at Good Samaritan, Interventional Radiologist. So, specialty that probably not as well known as cardiologists, oncologists. So, let's start off a little bit. Talk about where you trained, and we'll just go from there.
We'll go from there. So basically, it's the full term is the vascular and interventional radiology, because it was used to be kind of a doctor's doctor, where other doctors send you patients or issues that people need help with that they don't understand exactly where to send them to. So they send to somebody who's more behind the scenes. Historically, it's becoming more in front of the scenes. So my training was for NYU for medical school, MIT for undergrad, and then for fellowship and residency was NYU, and then Cornell for fellowship. It was vascular and interventional radiology with a specialization in oncology, right? So we did a little bit, half a year in Sloan Memorial Kettering Hospital across the way, where you do all the cutting edge things for oncology, interventional oncology, and pain procedures, things like that. And that's kind of been the true route for training. About 10 years out in practice, which I think is the perfect amount, and to be kind of a steady hand, and then now joining Good Sam. Yeah. It's part of the team.
And we're so happy that you're here and the skill set that you're bringing. So radiology, talk a little bit, diagnostic radiology, probably what the general community recognizes when they think of radiology. So talk diagnostic radiology versus interventional radiology.
Yeah, so I mean, it's because historically it's been a field that uses more advanced imaging, try to be as minimally invasive as possible, which is kind of, for me, the calling card. You try to be as the least incisions, the most image-guided ways that you're not having to do an incision. You're trying to be as minimal, small holes, small incisions, and you use the different imaging modalities or different imaging styles, ultrasound, CT, classic stuff that you think about for a fluoroscopy suite, or even MRI guidance to figure out what are we treating, do we treat it correctly, and how do we make this as painless as possible. So the first part of the training is diagnostic. You have to understand what the strengths and limitations of different ultrasound, CT, and MRI. Each of them look at the same thing in a different way, whether it's bones or soft tissues. You try to understand that really well in the training. And then you leverage that training into the procedural side of things, where you try to keep things minimally invasive and use the pictures as our guide.
Excellent. So that diagnostic piece is the foundation of your training, and then you carry that forward to really the procedural aspect with additional training, and from diagnosing to treating the disease.
Exactly. So it's a lot of training, many years, but it's worth it because you come out really confident about what you're interpreting and make sure it's correct, because that takes a lot of work. And then at the same time, being able to use that well to not overdo and just try to be perfectly tailored to the person and be as minimally invasive as possible.
So what would be a typical day as an interventional radiologist? How many procedures do you perform? What are some common procedures that you perform here at Good Samaritan and are looking to perform in the future?
Yeah, so I mean, we do anywhere from 6 to 10 a day, depending on from small, where things that you may have heard of, things like where people have fluid around their lungs or in their belly, we draw it out, to biopsies, whether in the thyroid, in the lungs, anywhere in the body, right? And then to more longer procedures where you can try to fix a spine if there's a break. That's called kyphoplasty or vertebroplasty. Or if someone has a stent issue where they're either a pre-existing stent or a new place that's narrowed, to try to open it up. So we're working to become more develop what we offer locally for people who have arterial disease in their legs, or people who have pain with walking, whether it's because their arteries are not doing well or because they have chronic venous problems where there's pooling of blood in their legs that just doesn't exit as well. So we try to do a couple of different things to offer and try to expand on that route, plus working on the oncology side of things, where if people have spots in their liver, kidney, or lung that are just cancer, but they don't want to go through the big surgery of cutting it out, which is pretty invasive and has a lot of recovery time. We try to go in there and minimally kind of burn it out with this long needle or freeze it out and make sure that people can go home the same day and recover really easily.
Right. And that's proven to be such a valuable service to provide, because in the oncology world, there are a number of those patients that simply are not healthy enough to have surgery.
Right.
And so now we're providing another option to where they can still have a good outcome.
You just want to, I mean, at the end of the day, we're here for people. We want to make sure that you have the best possible response with the least amount of issue. So we want to make sure as well as possible to enjoy your years, whatever the issue is going on, we try to minimize the pain and improve your lifespan as long as you can. That's the whole kind of the goal of Good Sam in general, in our little corner specifically. So we're really trying to just, make the years people have the best quality they can and not to add to the problems.
That's excellent.
Yeah.
You mentioned at the beginning interventional radiology, kind of working behind the scenes, so to speak.
Right.
So, what are you meant? And we talked a little bit about the cancer care aspect. What are some of the common specialties that you work with or see patients that come
Overlap.
to you?
So we have a lot of folks from oncology, some from cardiology, especially as we start doing more and more peripheral arterial disease or venous insufficiency disease. Pulmonology a lot for nodules in the lungs that are maybe better for us because slightly lower risk for certain types of spots. GI, if somebody has a bleeding in their gut, we try to figure out how to get in there without having to cut out that segment. Try to minimize the way stop the bleeding for the most minimally invasive way possible. Pretty much any specialty we overlap with to some degree. That's why we've been behind the scenes as a way. That's why we do kind of a variety of procedures that cover a lot of bases, simply because with image guidance we can cover the blind spots that some specialties may not be able to cover. And that's one of the strengths of the profession that drew me to it.
You and I have talked a lot about the team that you work with and building the team so we can continue to grow and offer those services so care can be delivered close to home. What's the typical team that you're working with on a daily basis?
So I'm lucky enough to work with a fabulous NP, Tara Pierce, who's been instrumental. She's in the clinic. She's doing some procedures. We're doing inpatient care and follow-up. She's been wonderful. And then we have wonderful nurses and techs behind the scenes that you would meet a day of procedure. So whether in the pre-op, post, where we have a couple of nurses to make sure you're okay and make sure your pain medications are taken care of. And then in the procedure suite, we have sometimes one or two technologists and one or two nurses to make sure that we operate the case well and get you home as soon as we can. So those are the people. And then in the other side of ultrasound, we have an ultrasound techs who help out for procedures and CT techs who have run their aspect of things.
Yeah. And in radiology, we deal with a lot of very advanced technology. I'm curious, in your years of training and being out and practicing as a physician, what have you seen change maybe the most with technology advancements or changes that have impacted the way that you practice?
So, I mean, these are great questions, but the one I've seen the most is that things get smaller, which is nice. It's the better the therapies develop, whether it's the microbeads or the ablation needles or the stents, they're not only hardier. The material science aspect of this has come a long way, where the quality of the materials lasts longer, less chance for breaking or staying open longer. But there's just all these new tools that are more and more low profile in order to fix this without having to go to surgery. So that's the entire world is actually moving closer to IR versus big open procedures because people are realizing less is more.
Right.
And that's what's been our calling card for years. We try to be low profile, small, less intervention, easy recovery, and better long-term result.
Yeah, and you mentioned it earlier, minimally invasive, less is more, and that from a patient standpoint also lends itself to a large percentage of your patients are going home same day, maybe the next day, but as an outpatient procedure rather than long stays in the hospital.
Right. I mean, that's predominant patients go home same day in a couple hours. It's rarely that we have to keep folks overnight unless we're changing something dramatic inside. And again, compared to general surgery, it's not even close, right? where recovery times are pretty fast, incisions are minimal, it's Band-Aids and things like that. People go home within a couple of hours, and at the very latest next day.
Excellent.
Yeah.
So most of your patients come from referral. So your relationships with those other specialties, this is more from you as a physician, how do you make your services known and kind of promote what you can do so that we can continue to build that knowledge and keep, at the end of the day, the patient's care here?
So I mean, that's the thing. Education is the hardest part of any kind of communication. Is people don't know what you can offer until you tell them.
Right.
Because sometimes some things have a cardiology is clear what they do, right? It's in the name. Pulmonology, cardiology, GI. IR tends to be dependent on the person offering work sometimes, depending on where they trained, what they specialized in, what they're comfortable in. And so a lot of it's been just kind of meeting folks, making sure that they understand what we do and they're comfortable with it, and making sure the lines of communications are open. So it's been a lot of referral from other folks, and now more and more people start coming to us directly as they understand what we do and how to reach us. So the simplest way would be just to call our scheduling folks, and they can get you in to talk to us, whether directly or through your doc, and they could just call us. So as we reach out more and more folks, they're getting more comfortable with saying, hey, can you do this, or how do we do this? And then we make sure, if we can, we keep folks local, and if we can't, we'll figure out the right next step.
Well, we certainly thank you for everything that you are doing here at Good Samaritan. I can say in these first few months, I've had quite an impact, and really seeing how minimally invasive care can be delivered. And as you said, that is where things are going from a healthcare standpoint. And we're on the cutting edge of that, and it's a thanks to you and many other of our medical staff that are really driving that change.
Right. And it's a lovely community. It's small, but it's mighty, and the goal is to keep it healthy, and we'll do whatever it takes.
I couldn't have said it better. Maybe a CEO seat.
That's right. Future. That's right. Yeah, one day.
All right. Well, anything else you'd like to discuss?
Whatever people want to do, whatever they need to figure out, we'll either learn how to do it, or we'll find you the right place to do it.
Excellent. Okay. Well, thank you everyone for joining this session of Good Samaritan Spotlight.